Governor Inslee, this is his third visit with us. And you'll recall last year between Inauguration Day and Election Day, he made one public appearance, and that was here with you all last year. So we have seen him in his first year not only lead an administration that has implemented reform, I think, relatively well. I think you think that based on your applause for Richard this morning. But is also planning for pretty ambitious things in 2014, which is in part why we will be talking with Dorothy and Kevin here after him. So without further ado, please welcome the Governor of the state of Washington, Governor Jay Inslee. Thank you very much. Appreciate being here.
Good afternoon. Thank you, DJ. Thanks for your leadership. How about a round of applause for a guy who's helping this industry remain innovative? Thanks, DJ. I'm delighted to join you here for the 4th annual State of Reform conference, and I think this is a state of reform. Washington actually was named the most innovative state by Bloomberg News last week, and we are innovative in a whole host of areas of endeavor. And we are leading the world, and I'll mention 3 areas where we are leading the world right now. First, and again this Saturday, we will lead the world in an NFL victory with the Seattle Seahawks. So we're raising the 12th man flag down in Olympia here in a couple hours. Second, I think it is something for us to celebrate that we as a state have made a decision and cemented several more decades at least of a 100-year century where we can say with great assurance that we will remain the aerospace capital of the world for the next several decades. And I do think that's something to celebrate. And we have been able to do that because we have the best aerospace workers and a state that's fully committed to this aerospace future. And third, we are a state of reform and innovation when it comes to health care. And I am delighted to join the leaders of that innovative effort who are here today at lunch to keep this ball rolling. We know that we've got more work to do to make healthcare more accessible and more affordable for every Washingtonian, and to build healthier communities on both sides of the Cascade Mountains. Now, 1 year ago, I attended this conference, and I sat on stage with DJ, and we had a great discussion about our joint ideas about how we were going to pursue this healthcare reform agenda. So I'm back to take a little lap to see how we've done in the first year and to talk about the years to come. So first, I'm here to say, after 1 year of effort, that since that conversation, fully 200,000 more Washingtonians have health care coverage today because of the passage and implementation of health care reform. And it's a great thing for the state, and it's a great thing for individuals. I want to thank many people in this room who've worked for years on this subject. I want to thank President Obama for his leadership. You know, if you look at this from a historical context, I think it is a historic achievement. Every president since Harry Truman, if you come down to the governor's residence, and we have a roster of people who've visited the governor's residence. June 14th, 1945, the signature of Harry S. Truman was at the governor's residence. He was the first president who said that we should extend health care coverage to every American. And every single president since then has said the same thing, Democrat and Republican. We have now been able to achieve that. That's a significant event in our effort to have a more just, more fair, more healthy community. And it's not just the larger community, it's individuals. I think of Laura White, who was at our kickoff several months ago, who had a pre-existing condition that is no longer a barrier for her to get coverage. And she and her husband can continue to run their automotive business in Renton and start worrying about how to have a good business rather than worrying about how they're going to have insurance for their next crisis. It's important to people like Vera Johnson, a single mom with 2 kids who is a business owner in White Center. She's now got coverage for her family. And I think about a fella who showed up at our kickoff for this several months ago, a fella named Charles Jackson. Charles and he came up and reminded me that the last time we had met was when the Garfield Bulldogs played the Ingram Rams back in 1968. And Charles found himself now stuck between retirement and the age of eligibility for Medicare with a pre-existing condition. Now, I had to remind Charles that in that football game, the Ingram Rams won. So I told him that I thought I'd owed him a debt for 40 years that I had finally repaid. And we were happy about that outcome. So we've got 200,000 reasons plus to be thankful that our state has moved forward. But we know we've got more work to do. And I think that I've made health care reform a very high priority for my administration. So I'd like to talk about some of the successes that we have already had. The first is Medicaid expansion. By fully embracing the Affordable Care Act, including Medicaid expansion, we've made sure that the state captures over $350 million in savings just during this current biennium, even as we expand Medicaid to hundreds of thousands of Washingtonians. We're going to receive $1.2 billion of federal funds over the next 2 years and estimate over 10,000 jobs be created because of Medicaid expansion. This is good news, not just for health of Washingtonians from a physical standpoint, but from a fiscal standpoint. The only reason we were able to put $1 billion into education in the last year to educate our children and balance the budget was because of our bipartisan success in embracing health care reform. That's a great bipartisan success. Second, we've had another bipartisan success in increasing funding or continuing funding for our health benefit exchange after federal funding expires. This was with no net negative impact on the general fund. And this success shows how parties can work across the aisle to actually advance both our physical and our fiscal health. And I think Washingtonians ought to be proud about that, because in other states that has not been the case. We have been able to fashion a bipartisan path forward on here, and I think the Evergreen State ought to be proud. And other parts of the country have noticed. Our health plan finder success has been touted by the New York Times about how to do health care reform the right way. Now, we know even in our state we've had hiccups. We've had some hiccups getting this off the ground. But I'm proud to say that Washington State today is a leader in football, it's a leader in aerospace, and it's the leader in health care reform. And it's something we ought to feel good about. So this was a great step, but we've got more work to do, and I want to talk about that. One small and important step we are going to be working on in the years to come is improving employee wellness in our state employees. We have 55,000 state employees, and this is an important place where state government can practice what we're preaching, which is to try to improve our wellness in our lifestyles, in our work habits. That's why in November, I was happy to issue a new executive order which focused on 3 key areas to help improve health amongst our state employee workforce. First, by providing wellness assistance to all state agencies, we're going to create our own wellness programs within state agencies with progress reports on how these programs do every 6 months. Second, by incorporating wellness such as diabetes prevention and smoking cessation in state employee health insurance plans, we're going to help state employees really move the ball forward. I want to note and thank leaders in this room who have been working on smoking cessation. This is the 50th anniversary this week of our national effort to save lives in this country because of smoking cessation efforts. And I would like to thank my predecessor, Christine Gregoire, who happened to helped and led to fashion a settlement which has given funds to continue this smoking cessation efforts. Could we give a round of applause for the people in this room who've done such great work on this as well? And third, by requiring state agencies to develop and implement healthy food and beverage policies, including priority on providing Washington-grown produce in cafeterias and on-site food establishment. I have established a secret weapon in the war against obesity. It is a Washington State apple. I brought Exhibit A here today, okay? And our director of ecology, Maya Balone, is speaking to the Yakima as we speak to the ag business leaders there. We're going to sell these apples in China, and we're going to eat them in the schools in the state of Washington. So I'm happy to tell you that we're working on that. So as you know, this is personal to me. I want to set a tone, and I want to take some big steps in the upcoming years in this regard. Now, this is going to help healthcare costs under control as well, so that our businesses can continue to be competitive. This is not only a health issue, it is a business issue, because costs have grown historically at 7% over a year over the last 7 years. That is unsustainable. We know that Boeing and other companies have to be competitive, and healthcare costs are an important part of that competitive position. But I believe we can control costs, and we can provide world-class health here in the state of Washington. And Washington is a perfect place to be an optimist about this, because we are the most innovative state in technology. We are the most innovative state in public policy. We are a state that understands that if we work together collaboratively, we can do great things. So I think it's the perfect place to lead the country in this effort in cost containment. So we've been talking about these ideas now for the past several decades. Now it's time to really put them into action. And I know if we can work together, we're going to be able to make these necessary changes, and we're all going to be better off. Washingtonians are going to have better health. Doctors and nurses in hospitals are going to be able to deliver better, timely, more scientifically evidence-based medicine, and costs will be contained. So in addition to the exchange and Medicaid expansion, it's now time to look what we can accomplish in the 2014 legislative session. So I'm pleased to announce our agenda for this session will be focused on 2 areas. The first is to make sure that the next generation is the healthiest generation in state history. Now, we used to kind of think that that would happen naturally, because it has happened naturally. But given the challenges that we face today, I'm sad to report that unless we change things, that will not be the case for the succeeding generation. This is a different type of health care and nutrition and physical activity we have before us, because up till now, naturally, the next generation who had maybe a little more milk and better protein and more health care would naturally be healthier and live longer lives than we have. That's simply not the case. This is a new type of challenge for us. And because it's new, we have to act anew. Some of my favorite childhood memories involve the outdoors. Walking on the beach with my dad, hiking to Mount Rainier where my parents helped revegetate the mountain alpine meadows in Mount Rainier, playing ball. Our kids don't have those experiences anymore to significant degrees, particularly kids who don't have access to some of the recreational things that cost money in our society. And the increasing inequality, which is dramatic in our state, is being reflected in the increasing lack of opportunity for physical activity of our kids in the state of Washington, and lack of access to good, fresh, wholesome, nutritional food. As a result, too many of our children are not at a healthy weight for their age, and they are not as active as they need to be to burn off those calories. And too many children at the same time are exposed to additional environmental challenges in toxins from their environment, from flame retardants to a host of other environmental insults. So our children are exposed kind of a triple whammy of lack of physical exercise, more toxins, and a lack of access to good, nutritional, wholesome food. So we're going to be requesting the legislature to do three things in this session. First, establish a governor's council for the healthiest next generation, made up of legislative members, agency heads, and community and business leaders who are invested in protecting and expanding healthy opportunities for our kids. Second, we'll establish a strategic work group of experts from the Departments of Health, Early Learning, and our Office of Superintendent of Public Instruction. And third, we're going to require our work group to take specific actions that improve the health of Washington's children, including supporting comprehensive breastfeeding policies that we know work and have lasting benefits for years, creating a mentoring program to help teachers and caregivers, and revising statewide health and fitness standards for schools. This is going to be tough for us, but it is important. We have created a lot of new demands and requirements in our schools, and we understand why that is important. But we are going to have to help schools where our kids are 6 hours a day find ways to give kids some physical activity. I sponsored a bill in the legislature. It was called the Fit Kids Bill. We euphemistically called it the Leave No Child on Their Behind Act. And we are going to need to be involved in efforts to give children more exercise opportunity in our schools, and I look forward to you and working to help schools to be able to achieve that. And as I've said, as a grandparent, this is personal to me. I got 3 little kids, and I run them ragged. They run me ragged every chance we get. But we've got to have more kids have those opportunities. The second agenda item for the 2014 session is about better health care purchasing. And now this is an area where I think we agree we've got a lot of areas, room for growth. The costs we pay are high and growing, rapidly becoming unaffordable for families and businesses. And so there are things we can do right now, and we should start this effort. We need to set clear goals and measure our performance and pay for outcomes. We can do that by doing 3 things. First, we need to agree on our goals and set performance measures that we all will strive for. Common, accepted, mutually understood performance metrics. Second, we need understandable information that we can pair with quality measures to finally measure value and enable all people in the state to make health decisions on both cost and quality. Now, in doing this, We all have our independent jurisdictions and entities to work on. As a leader of the state of Washington, I'm going to ask everyone in this room to lift their sights and their vision on the common goal we have for the health and cost containment in this state. This is one place that cries out for leadership. And everybody in this room, in some capacity, as governor, as a purchasing person for a healthcare provider, as an insurance industry leader, this is an opportunity for leadership. And leadership is a situation to ask your team to raise their sights to a common goal. And if we do this, we're going to lead the world in cost containment. But it's going to take a mutual joining of interests here. And I'm going to ask everybody to engage in that leadership exercise. Families need to know this information, and purchasers, as they're being asked by employers and insurers to pay more out of pocket. And all purchasers of health care need current and actionable information. And third, the state is going to change how it purchases health care. We're going to get more impact for our public investment by integrating behavioral health with medical care, purchasing on value, and rewarding providers who meet the agreed-to performance measures. But improving health care is not enough. We have a much greater impact on health of our communities if we ensure that mental health, housing, and other social support work closely is allied and integrated with providers of medical care. So we will be supporting local communities to work together to identify their problems and their goals, and to use our purchasing power to assist communities to integrate available services at the local level. And here's a place where a state can be a positive force in this goal of integration that I think all of us should share. So in closing, I want to reiterate that this is a great time to be in a great field, which is healthcare. It's hard to think of another place where we can exercise more creativity, more vision, more leadership than healthcare today. And it's an exciting time to be governor because of that. And it's particularly exciting to be in a state that really gets it on innovation and gets it about what we can do if we can work together. So we're going to work together to make sure that every single Washingtonian has access to quality care, that that care continues to get better, that we use whatever tools the state has to assist families in improving the health of their children, and by supporting and assisting local communities, make sure that we can work together. And I want to thank you for all of your individual work. We are moving the needle. This is a moment of historical change that we're engaged in. And I want to thank you for being part of that history. So thanks a million. That's my story. I'm sticking to it. I think DJ is going to ask me a couple softball questions here that we can talk to. So DJ, you want to help me out here? It's up to you. Your call. Your call.
Well, sorry, Stephen. The governor said I can make a decision about whether we ask him any more questions. Because you're out of time. I appreciate that you're extending your time with us. It means a lot that you engage this community and you come year after year, and thank you. And I want to say thanks briefly and then ask a sort of a general question. Compared to the prior administrations, in my view, your administration has been much more engaging and more active in listening than previous administrations, and I think a lot of members of the healthcare community appreciate that about your team, so thank you. This integration question, the procurement strategies that you're talking about in terms of a phased approach to integrating medical, physical, and mental health, is ambitious, and empowering local regional oversight is ambitious. It's going to take a long list of months in terms of your leadership to get us to that goal. Tell us about some of the principles that you bring to that policy question. We don't need to get in the weeds of all the policy, but how do you view this question of integration as governor?
Well, several ways. First off, it is absolutely necessary to start with. So the first thing I would say, it is a necessary step on this road, both to better health and better cost containment. So the first thing I would say, it's necessary. Second, I would say it is achievable because we've seen what we can do in a variety of contexts if we decide all to be common leaders in this regard. Third, we have additional informational technologies that now make it much more feasible because we have electronic databases that can make this actually achievable. So it is hard, but we have three things going for us to make this something we can achieve. I think my role on this is to try to inspire people, frankly, to understand what an historic achievement this can be, and that by being part of a larger team, that is a huge victory.
Yeah.
And so that's the role I'm going to try to play. And I'll be a little demanding on occasion, too. I think that's another part of the role that I can play in the right way. So thanks for that question. That's going to be the challenge of the day. My closing comment, I do want to thank you. I also would like to leave here by asking us all to thank the members of Unite Local 8 who've served a great lunch today, too. We recognize where our food comes from, hardworking people. Thanks a lot. Take care.
Thanks, Governor.
Thank you, guys.
Thank you very much. I appreciate it. Great. Thank you, Governor Inslee. Let me try to bring it all in here. So, Secretary Kevin Quigley, thank you for joining us. Director of the Healthcare Authority, Dorothy Teeter, thank you for joining us. Regional Director of Health and Human Services, Susan Johnson, thank you for joining us. Kevin, because you're my friend, I'll pick on you first. You're all my friends. When you were chair of the Senate Healthcare Committee some years ago, you should listen to this, Senator Becker, because you may be Secretary of DSHS one day. You made the comment as a legislator, you know the one I'm going to read. We appoint a new person to DSHS, we chew them up and we spit them out. You said, I joke around about it, but the average DSHS secretary lasts about 22 months, so let's go. You're about 55% of the way through that now, and you have been called a disruptive force, and now you're really at the top of a time of transformation at DSHS that is, I think, quite uncommon. So tell us about your approach to the job and what you're working on.
Well, first of all, I think you broke the rules because you said if I came to chat with you, you would only ask me multiple choice questions. So obviously DSHS much broader than healthcare alone. I love to share with people the fact that DSHS, we serve 2.2 million of our state's 6.8 million people. And when you have that opportunity, it's actually a wonderful thing. In fact, it's so wonderful that it's worth getting chewed up and spit out after a couple years. The other thing is the fact that your tenure is so short, you can have the leeway to be super straight with people about where things stand. So it's actually a fantastic job, and with the help of my colleague from CMS, we have some extra head tension on the mental health issue these days.
Which we're going to get to talk about in a second. Dorothy, now that you're at the Healthcare Authority, of course, you've been at Group Health, and you've been at King County Public Health, and you've been at CMMI. You have worked these issues from the inside of the state on the private and government side. You worked them at the national level. What are the things that get you most excited about this time in healthcare right now?
Well, I don't think that there's probably a time that it is more, I guess I would use the word historic, at least in the time that I've been in healthcare. I know at the Healthcare Authority, when we're going through the daily struggles of really doing a massive system transformation for the Medicaid population as well as those that are uninsured across the state. On those days where we just go, oh, this is just incredibly difficult. Are we ever going to get through it? We sit back and remind ourselves that we're making history, and this must be what it feels like. So I know all of the folks out in the eating lunch right now feel the same way some days, but we have to remember that, and I think that's the most exciting thing about being at the Healthcare Authority right now is the making history part. And I also just have to say that having spent almost 2 years back in Baltimore at the Center for Medicare and Medicaid Innovation, it was very fun for me to be there and go, hey, I'm from the state of Washington, because number one, the reputation that's back there is pretty awesome in terms of innovation, and also just knowing what the assets are in the state and looking forward to coming back here. It's been just exciting to come back and realize what the unbelievable talent there is in this state to keep things going.
So sticking with you for a second, Dorothy, the governor laid out his legislative agenda. He talked about purchasing and procurement, and you have been at the head of an agency leading an innovation effort funded by CMS. Tell us, many folks have read the document or the plan that was produced here recently, but tell us about the values and the principles that you've brought to that conversation. There are some very interesting innovations in there, particularly around regional approaches and oversight, accountable collaboratives of health, et cetera. How has the CMMI work that you've done influenced the way you view that? And like I say, what are the principles you brought to that question?
And I'll just be brief about this, but I had a privilege actually when I was at the Innovation Center to lead the Healthcare Innovations Award Program, which was a $1 billion award program that was at my request, and we had the privilege of working with Don Berwick at the time, had an open-ended, what are the ideas from the field, what are the innovations from the field that will achieve that three-part aim of better population health, better cost, and better quality performance for healthcare systems. And I think having read hundreds and hundreds of those applications, what the values that kept coming through from across the country and the concepts are ones that I think you see in the innovation plan that we put together. Kevin obviously was part of that. Susan consulted with us, as well as many of the folks in this room, are how is it that we can use the dollars that we have to truly benefit the people that live in the state of Washington from a health perspective, but also leverage the innovation and the actually quite brilliant people that we have in this state to continue to lead and innovate in the way that Washington State can. So I think the values were really keeping the populations and the people that we serve at the very, very, very core, and making sure that as we lead and innovate that and trying to achieve that three-part aim, we're doing that always with the people in mind. So it isn't just creating systems in the ozone and saying, oh, these are brilliant, but really, is this going to help the people that live in the state of Washington lead healthier and more productive life?
Yeah. Susan, we really do have this sort of Washington way, as you know, from your multiple hats in your career. Previously on the advocacy side, now at CMS, where as regional director you have
HHS.
Oh, excuse me, thank you. It's an important acronym difference, right? You have oversight, or you work with 4 states, Idaho, Alaska, Washington, and Oregon. And as I look at those 4 states, and really maybe all of the states like Arkansas and Florida that have had conversations with the administration around innovation, I see the federal administration really reaching out to Alaska. Oregon got a couple $1 billion, or $1.9 billion. And we get these letters from CMS that say we got to change stuff. So my question is, why doesn't HHS love us? Why are we the stepchild of the federal government?
Oh, DJ, there you go again. HHS loves all of our states. We just love them in different ways. Seriously, though, we have a lot of different roles. One role is regulator, kind of policeman, that gets tiresome for all of us. Another role is partner. And I look forward as the innovations go toward concrete implementation, how we can be as flexible as we can be with our waivers, where we can also help de-silo our efforts to help integration be even more holistic, as the governor said, so that we don't have an ironic situation where someone has a healthcare home and not a home with a roof. How can we explore those parameters and have us all stretch? But I think that that is the new term. I've heard the Secretary say many times a week, we want to be flexible, we want to respond to your desires, we want to work with you, so we stand ready to do that with Washington as we always have.
Yeah, and I know that I have heard specifically CMS, but I'll apply this to the federal administration generally. I've heard the administration say things like, we don't care how you get to Detroit, pick a city. You can take a plane, you can drive, you can walk, but you got to get to Detroit. In other words, we don't care how you live within the parameters of our Medicaid contract writ large, but you got to do what you said you're going to do. On the other hand, it seems like there's a pretty, a pretty significant level of engagement in some of these states from the part of the federal government to work with those states, and in a way, I think that maybe is different than prior administrations, a little more activist federal government in terms of collaborating. So within that vein, as Washington thinks about integration and we think about changing our system for Medicaid, what would your advice be? I'm sure you've given private advice, so we're just a bunch of friends here. What would your advice be to the administration as it responds to regulatory oversight from the federal government and the opportunity that is unique during this time in healthcare?
Yeah, the one thing I worry about, just to start with that, as a lobbyist of many years, start from your worst fear, work back so you never get there. My thing that I worry about now, and maybe it's just coming off Oregon's situation with the exchange, and granted that's totally different mechanics than an innovation implementation, but scale, scope, and timing, I think is something that I just want to make sure Washington has a huge blueprint of a grand design, but a very specific phased-in approach so that one foot starts on the most solid ground of what is currently there in a community and moves forward so that there isn't the option for anything to crumble because of its own weight. So I just look forward to making sure the words on the page are implemented so that there can be good, quick wins and build from a solid foundation.
Yeah. Kevin, this phased approach I know is something that you have given a lot of thought to, or Susan's speaking about a phased approach. I know that you have thought about a phased approach in terms of responding to the procurement integration and ultimately integration of care generally. Walk us through what the last 6 months have been like as this question has been discussed within the administration generally, because I know there has been tremendous thought given to where we stand today. Tell us how that has evolved.
So when you say this question, what I assume you mean, of course, is the integration in particular of Medicaid purchase mental health services into the larger purchasing of physical health services. And actually, well before we got our letter from CMS, there were a whole number of areas in the whole mental health field that we were super engaged in. And the first thing you got to do, I think, is you got to get the lay of the land. And even though you outed me for being a former senator, I spent the last 15 years as a business person. So just to talk in terms of round numbers, I look at the situation, I say, okay, DSHS, we're spending $2 billion basically to take care of people with severe mental illness and with chemical dependency issues. And that really then has two pieces. That's our mental hospitals, where it's really the deep end of the pool, where we had, frankly, an enormous number of challenges. But all those people are cycling through that system, and our ability to put them on the road to recovery, because basically 90 to 180 days, virtually all of them are coming back to our community. How do we fix the mental hospitals? And there we had phenomenal leadership on a bipartisan basis from the legislature. I mean, there's a lot of chatter as if nobody's getting along, but right out of the blocks, both the Senate and the House passed budgets that took the first step in fixing the mental hospitals. So that was the first thing, fix the people who are moving through that process. And then the second process was, okay, now when I come out of the mental hospitals, or even before I go into them, what about the system to take care of them? And as everybody in this room knows, that's our community system, which we call our RSN system. And there, we break down that $2 billion, we're spending about $1.2 billion every year. So, well before we got our early Christmas card from CMS, the legislature had directed, and at DSHS we were jazzed about it, the idea that we would move to more performance measures within our community health system, community mental health system, in order to make that work. And that was kind of the trajectory we were on. For me, there was no doubt we had to work in that area. What changed the playing field a little bit is with the new direction we have from CMS, what they're saying now, if it ends up coming to pass, is you basically, instead of solving that problem with performance measures and performance-based contracting, need to go to a more open procurement model. Either way, whether we end up going to an open procurement model or we end up using performance-based, those are areas of the system it was clear from the very beginning we needed to work on. Yeah. So we're just kind of trying to determine which tends to be the bigger focus when all the dust settles.
Yeah. Yeah, let me sort of ask a follow-up. I mean, even Oregon, which has been mentioned, even they carved out long-term care in their integration work. And implicit in some of your comments is that we're talking about a particular type of integration and not everything, certainly. I think you've been very sage in describing the long-term care system in Washington State. Really great if you're rich, really great if you're poor, not so great if you're in the middle. What do you maybe give us an update on long-term care, but how does it play into this conversation about keeping people healthy, particularly dual-eligible populations, and integrating that population into everything so that we're not leaving them out?
Okay, so I won't make everyone happy on this, especially some of my favorites in the legislature, but for me, first of all, I follow the numbers. We're spending $3.8 billion there. Of all our DSHS departments, it's the biggest area of spending in long-term care. But the difference there, as opposed to the mental health world, is we're a national leader there. And so if you were me in this job, you'd see there are things you have to work on, like adult protective services. You'd see that there's some really good legislators who are pointing out, look, you got to take the individual providers who are seeing these people all the time and be more innovative at that level of integration. Obviously, as you know, we have the duals and other plans where we're working on integration. But to be totally frank, in the DSHS world, where there tends to be a lot of brush fires, that's an area where we're leading the pack in the nation. We can do more, sure. But when it comes to long-term care, it tends to be less of an area, and there we're really focusing on our problems with adult protective services. Whereas when it comes to the mental health area, I mean, it's bad. We've got the boarding issue that everybody knows about. We don't have a good system of accountability for community mental health. We have not enough local psychiatric beds. We have really bad efforts to treat the whole patient and so forth. So in honesty, it's much more of a focus, how do we fix the mental health system? And I would say, start to create the true behavioral health system where we take the comorbidities of chemical dependency and mental health and create a whole there that's going to work better. So that's been a little bit more of our focus, I would say.
Yeah. Dorothy, we're talking about Medicaid. As Medicaid changes, it may have some significant impacts on the rest of the commercial marketplace. I know this is not an either-or question, but if you had to pick, how does this community prioritize the question of integration of financing versus integration of care? I know it's sort of phased, and I know it's multifaceted, but as these organizations out there, this diverse population is trying to be responsive to Medicaid, both directly and indirectly, where should they be focusing their efforts with recognition they have limited bandwidth? Should they focus a little more on this integration of financing element or a little more on the integration of care element?
So if I'm understanding your question, you're asking if you're a care deliverer, a delivery system, which place would you put more of your focus?
Well, care delivery, health plans, I mean, the silos
I gotcha. Okay.
between mental and
Okay.
physical are so wide.
So
Or
and
you could
this
guess.
is really, again, focused on that integration of behavioral health with physical health, and I'll throw in dental along the way. I think form follows function to me. So I think we have to really do both at once. What does that system look like where if you're a person that has both a mental health issue as well as a physical health issue that are intertwined or they need to both be taken care of, how do we design systems where, depending on who you are, you can either go to one place or another to get your full integration of care? I think, so to me, you always have to start with what's the evidence base for the best way to take care of people from a clinical and a social behavioral perspective, and then figure out how the funding can support that. And I think from the discussions that Kevin and I've had at the state and ongoing with our CMS partners, it's really how do you make the money that we have work the best to support that integration of care that we all want. And that doesn't mean that everything all goes to one place or another. It means that whoever you are as a person that needs those systems to work for you, they work for you. And that they're not built based on the kind of vagaries of administrative and financing streams that maybe at the state level we have, but rather we work to ensure that the money can support the best care delivery model. Mm-hmm. And if you start with that end in mind, it's a lot easier to figure out the funding streams. Mm-hmm. But we all know in this room, looking around at all my friends and colleagues here, it's really not a great, and we just heard the governor say this as well, to bifurcate your mental health from your physical health or from your dental care also. That puts a huge pressure on a person to say, okay, where do I go for this relative to where do I go for that? And what we really need to build out is a system where really there's no wrong door. You can go wherever you want to get that full integration of care. With some special attention, at least from where I sit, for those really medically or clinically fragile, mentally fragile folks that truly need a different system. They need extra supports. So I think it's really trying to put all those pieces together with what we know across the state. But at the end of the day, to design the care system and then make sure as the state, we can make sure the money follows the care.
I want to invite you all to come and ask a question with the few minutes that we have left. Of course, the mics are set up, and please don't be shy. Susan, switching gears a little bit, you must have had really just the time of your life defending the Affordable Care Act in Alaska in October and November. Idaho, that must have been really fun.
Well, I had to learn how to tone the volume down on my phone because people were yelling at me so much, and I finally thought, I'm just going to fly up there and they can yell at me in person. And so I've decided I go up there once a month for a week until they've run out of their voices and they're tired of yelling, and then I win. So. But I wanted to piggyback on something Dorothy just said, because in another century, it seems, I taught 6th grade in a small town in Vermont, and I have seen through my short career teaching before coming out here to do other things, an incredible transformation in the education system toward outcomes, toward integration, toward holistic teaching and learning with the kid, the child, the young adult at the center. So we know it can be done. It just seems so much harder in healthcare. I'm not sure why, but I have a favorite story about how integration seems so simple, you get it, but then there are these forces in every classroom that can pull it apart. And one of my favorite stories from the 70s when the new world of education was just beginning to be integrated was a story about, I think it was a 4th grade teacher who was, in control of that room, and a little kid comes out from recess, sits at his desk, and he's got a toad that he found outside, and he's fascinated with the toad, and he's learning all this stuff about the toad, and it probably peed on him and did all this, and the teacher says, "Johnny, put away that toad, it's time for science." And I think we just need to be wary of that when we use the word integration, that we protect it and we catch those times when we think we're integrating and then right away we pull it apart.
Yeah. So in our last minutes, Kevin and Dorothy, I want to ask you about what it's been like in the administration, sort of from a personal perspective. You got on, I think, in January and about April, respectively. 2 questions to you, Kevin. What's it been like? And maybe first, before I ask other questions, are you still commuting from Lake Stevens at 4 in the morning down to Olympia?
Yes, but I would point out in an electric car. Yes, I am.
When are you on the road?
If I can hit the road from my house in Lake Stevens by 4:45 or 5, I can get down to Ole in an hour and 40 minutes. So.
And your wife thinks this is a good idea? That's a long
So,
commute.
my wife runs a school for the deaf, so she's committed to helping people as well. So
Yeah.
What can I tell you?
Yeah, the patience of Job. So, DSHS, as you know, has had some history of challenges. As you commented on 20-some years ago as a senator. But everybody I talk to, and which is not everybody, but a lot of people I talk to, I haven't heard a negative comment yet. I'm sure there are many, but I haven't heard a negative comment yet about how you've been leading DSHS. And so my question is, does it take a business person with business management experience to lead an agency that complex?
Well, the truth is, when you're running DSHS, it's just so big. 2.2 million clients. Can you imagine how many computer systems we have, how many programs we have? I have 17,000 colleagues out there providing services. Something's going to happen, and some things have already happened. You just can't go there. What you have to say to yourself is, other than being the ultimate big cheese, the governor, how are you ever going to have a chance in your life to have a positive impact on so many people? And if you can get there, then every day is a gift. And I know it sounds silly, but it really is. I know that we've done some things that have been really cool, and I'm absolutely convinced more kids are safe because of it. I'm convinced that with the new CEOs we have at the 2 mental hospitals, more of my fellow human beings are going to get better services. I'm convinced ultimately we're going to win this fight on getting funding for adult protective services money, and that when we do that, we're going to save more people. So for me, it's just a wonderful opportunity. But I have no illusions that the day won't come that everybody in here is going to pick up the newspaper and go, "Oh, that guy seemed okay, but how could he do this idiot thing?" And so you just can't think about it. And I think business person, not business person, it does change the way I lead, because I follow the money and I reorganize the department, and I'm in the CFO's office about 16 times a day, and before the CFO didn't even report to the secretary, which is a little bit odd. But no, I think it's just lucky so far, I would say.
Yeah. Well, some people make their own luck, right? Dorothy, how about you? What has it been like at the top of the Healthcare Authority, which, frankly, was a little bit of a turnaround project since you've taken it on?
Well, I would, first I'll echo what Kevin just said about the opportunity to influence in a positive way so many folks in the state of Washington. It just kind of, you have to keep that front and center of everything you're doing and saying. The team at the Healthcare Authority is absolutely awesome, the knowledge base and the commitment that's there. And so it isn't that you're doing anything by yourself. You've got this tremendous group of folks within that agency. And then also out in the state, there's just not a day that goes by that someone doesn't pick up the phone and call me and say, hey, I have an idea, or hey, what were you thinking about that? Or how about we whiteboard this idea, it's just not clear to me. So I think for me, it's been just, first of all, working in an activist administration with, you heard Governor Inslee, he's just, you know, every cabinet meeting, he reminds us that we're here to do hard things, which that's helpful, so, because they are hard. But it's an activist administration that's very progressive in terms of new policies, tremendous freedom to really work across state agencies, but also with the people in the state. So it's been just an awesome experience. And you know, I'm not so sure it was a turnaround as much as it is getting really people ready for what we are experiencing now in terms of this historic transformation. And it's tough, and it's hard, and it's pretty awesome when you step back and go, wow, we hit those goals.
Yeah.
We hit the targets for the number of people that we were going to enroll in Medicaid. We did what we said we were going to do. So, and that's just because of the incredible collaboration across the state. So it is hard and fun both.
Yeah. Susan, I'll give you the last word. You know, again, with the perspective of working in a number of states and at the federal level, what advice would you give the organizations represented here today as they try to navigate through 2014?
Well, I don't know how many of you saw Walking with Dinosaurs over the holiday season. Anybody see that? Am I alone? Well, anyway, I'll
She's
tell
the
you
only
anyway.
one. I don't see any hands.
So there's an interesting part in Walking with Dinosaurs because, of course, it's the evolution, right? I mean, they're not going to be here forever, and they're going to have to adapt and change. And there's sort of a moral decision in this little dinosaur family whether they're going to go with the eat or be eaten mode or do the right thing. And it was hard for the dinosaurs not to eat each other when they realized they were going to go away anyway and they better do the right thing and maybe they could live longer. And I'd say that to you, you know? Is it going to be eat or be eaten out there in competition, or what is collaboration anyway if that's do the right thing? What's it look like? What's it feel like? Because we know what eat or be eaten looks like. But what does collaboration look and feel like? And let's try to get that model going.
Because they're all going to die anyway.
Because we're all going to die anyway.
Anyway, that's great.
Regional Director Johnson, thank you. Director Teeter, thank you. Secretary Quigley, thank you very much. Thank you. Thank you. Good.